Thank you for watching this short slide presentation on the role of GLP-1 in the regulation of your food intake. GLP-1 is a hormone secreted from your brain and the cells in the gut. It acts to reduce your appetite and increase insulin secretion. In addition to increasing insulin secretion, it also reduces gastric acid and gastric emptying. These effects make you feel full, reduce hunger, and reduce the amount of food you wish to consume. GLP-1 is released in response to food intake. From this graph here, we can see the plasma levels of GLP-1 go up and then fall following a meal. Here is a picture of the molecule GLP-1. It has a half-life of 1 to 2 minutes. This means that your feeling of fullness does not last a long time. The reglatide is similar to GLP-1, except there are two different amino acids. This small difference gives it a half-life of 13 hours. The reglatide is what's called an analog of your own natural GLP-1. That means it's similar but has some very small changes. These small changes mean it's harder for your body to remove it. So the effects of reducing your appetite last for a lot longer. What is liraglutide? Well, liraglutide 3 mg has been approved for use by the FDA and the European Medicines Agency for the treatment of obesity. It's an injection treatment for weight loss and is used in conjunction with a healthy eating plan and increased physical activity. You should be careful not to confuse Saxenda with Victoza. Victoza is another medication containing liraglutide, but in a lower dose and is specifically indicated for the treatment of diabetes. You should not take these two drugs together. Does the liraglutide work? Well, there have been a number of studies, and an example is a study here. This took two groups of people, one taking liraglutide and the other a placebo, that is a dummy drug. The two groups had their weights measured at the end of 56 weeks, and the results were startling. In the liraglutide group, 63% of people had lost more than 5% of their body weight. 33% had lost more than 10% of their body weight, and 14% had lost more than 15% of their body weight. Overall, the weight loss was 8% in the liraglutide group and only 2.6% in the placebo group. The study also showed that liraglutide helped reducing the risk of type 2 diabetes and also helped sustain the weight loss compared with the placebo. Is liraglutide the right option for you? Well, that rather depends on if you've tried the conventional methods for reducing weight, such as a healthy eating plan and increasing physical activity, and your body mass index or BMI. If you are fit and healthy, then your body mass index should be 30 or more. However, if you have at least one weight-related comorbidity, that is, an illness associated with being overweight, such as type 2 diabetes, high blood pressure, a lipid abnormality, or obstructive sleep apnea, then you can start liraglutide with a BMI of 27. You should be aware that treatment with liraglutide or Saxenda should be discontinued after 12 weeks if, on the 3 mg per day dose, you have not lost at least 5% of your initial body weight. If this is the case, this may not be the right treatment option for you. The European Medicines Agency advises that liraglutide is associated with transient gastrointestinal adverse reactions, including nausea, vomiting, and diarrhea. These reactions were observed in the trial data and were found to be very common, present in approximately 10% of subjects. Fortunately, these effects are transient and improve with time. Other effects were also seen, such as indigestion, abdominal pain, and reflux. Increasing the dose slowly seems to help with these reactions. The dose should be increased to 3 mg once a day in increments of 0.6 mg at intervals of at least 1 week to improve this gastrointestinal tolerability. If escalation to the next step is not tolerated for 2 consecutive weeks, you need to consider discontinuing the treatment. We do not recommend you take a higher dose than 3 mg per day. In the diagram here, you can see a typical regime, where the dose is gradually increased from week 1 to week 4 by 0.6 mg. And at week 5, you are then taking the maintenance dose of 3 mg per day. What happens if you miss a dose? Well, liraglutide is a subcutaneous injection with a half-life of 13 hours, which means you only need to take it once a day. However, if you miss a dose within 12 hours from when you would normally take it, you should just take the dose as soon as you can. However, if it's going to be less than 12 hours until you take the next dose, you should just take the next dose and carry on as normal. Do not take an extra dose or increase the dose to replace the missed dose. Is there a risk of overdose? We know from clinical trials that liraglutide is a safe drug, and overdoses have been reported in subjects taking 72 mg, that's 24 times the recommended dose for weight management. In these subjects, they were found to have severe nausea and vomiting, which is to be expected. None of the subjects experienced severe hypoglycemia, that's a fall in blood sugar, and all patients recovered without complication. In the event of an overdose, you should have the appropriate supportive measures, depending on your signs and symptoms. You need to be observed for dehydration, and your blood glucose should be monitored. If there are any other concerns, you should let your doctor know. Thank you for your attention. Here are a number of references and further reading of the formal studies that have taken place.